In this new video about mandibular tori, I thought it will be a great idea if I can share a little bit more details with you about the surgery itself and also include some of my patients who had the surgery done and let them explain in their own words their experience with the surgery and then with the results. Also, we'll dive into the technical aspects of the surgery, what to expect, and how we deal with the long term.
I came in for surgery on my tori because I was having trouble sleeping. It was affecting my eating. My tongue was raised up so high that I had trouble swallowing, and then I also had trouble speaking. So I was sort of starting to lisp or something. When I went to the dentist, I couldn't have the x-rays normally done. They had to pad everything. It was ridiculous. It was very difficult to do. I had trouble keeping my teeth clean. Because particularly on one side, the bone was so high that I couldn't get down in between my teeth. So I came in to get the surgery done, and since I've had it done, it's been an incredible difference. My tongue is normal now. I can eat normally. I sleep much better, and I can keep my teeth clean, and I can get x-rays. So anyway, it's made a huge difference in my life.
So let's go through a case. Here we have two large mandibular tori. We do a clinical exam. We take an intraoral scan and a 3D CT scan that can help us look at the anatomy of the tori and can help me decide where the cuts will be. From that, we make a surgical guide that we can use during surgery that can help precisely decide where the cuts should be, and that reduce the amount of surgery and post-op complication. We use the Piezo, which is an ultrasound, to make a nice and thin cuts in the bone, and then we go ahead and take tori out. We put a few stitches in on one side, and when we're done, then we start the other side. Make similar cuts, decide on where should we start using the surgical guide that we made previously. We'll take that, put it on the area, and we go ahead and create the first cuts with the Piezo, which is the newest and the latest and the best technique available to have the tori removed. As you can see, the tori is removed. Nice, clean cut. Make sure that there is no rough edges before we put the stitches, and go ahead and finish the surgery. Usually a few stitches, and it takes a week for them to be removed. As we can see, this is the large tori, which is removed neatly and cleanly.
My large mandibular tori was causing issues for me in many instances, and we drove all the way from Michigan to come to Maryland in order to get them removed, surgically removed in a proper way. And it's been a week already, and we can already tell a difference. I've talked to some relatives on the phone checking in with me, and they already said they could tell a difference with my speaking to them. I have gone many nights without my machine. I have gone back to the machine, but my husband says my snoring is better than it was pre-surgery, and hopefully I'll be eating more normal food here soon, but obviously from the surgery I was restricted, so I'm looking forward to that.
Another example of how the use of the Piezo surgery and CT scan and intraoral scan can help make the surgery go smoothly, precisely. When we look at the CT, we digitally design surgery. We take that information, we go to the patient. Even with the largest mandibular tori possible, the information that we have in the diagnostic tools, we're able to use a surgical guide and use the Piezo to make a precise cuts and make the removal of large tori easy, straightforward. And as you can see, the large tori has been removed cleanly. When you look at the surgical site, it's clean. There are less sharp edges, and the mandibular tori is removed neatly, so that can expedite the surgery and ensure that the follow-up result is as great as it can possibly can. So piezo surgery, the only way. So what are your instructions after you had your mandibular tori removed? We ask that you take it easy in the first 2 days after the surgery. Try to avoid excessive workout. Make sure that you are taking your prescribed medications, whether it was antibiotic or pain medicine or any mouth rinse. Make sure that you stick to cold liquid diet on the first 24 hours. The best diet is ice cream. So here you go. Try to avoid hot beverages like hot coffee or hot soup, because heat will make you bleed more. So let's stick to a cold diet for the first day. Then you follow that with soft diet for the next week, and there's plenty of options, so you're not going to go hungry. Try to avoid brush the area vigorously. You don't want to harm the surgical site, so there is a balance. We want you to keep your teeth clean, but we don't want to traumatize the area. So we have to find the right balance to keep your mouth clean and to protect the surgical site. Sutures will be removed in a week from the surgery day, and at that time, any new updated instructions will be discussed with you. Sometimes we have to give you a certain device, a retainer, that can help keep the surgical site isolated. I hope that can explain what you need to do after your surgery. If you still have any more question, please don't hesitate to visit our website or call the office and try to set up your consultation. Good luck on your tori removal, and thank you.
If you're getting value out of this video, please like and subscribe so we can reach out to more people like you.